Hi, I'm Rachel and I'm a wellbeing practitioner working for the Staffordshire and Stoke-on-Trent Wellbeing Service. I'm joining you today for this video talk because we work alongside physical health teams like the respiratory team, and we specialise in helping people improve their emotional wellbeing when living with a physical health condition. There is growing evidence that our physical health and emotional health impact on each other. It's been shown that around 30 to 40% of people living with chronic obstructive pulmonary disease, COPD, will experience changes to their emotional well-being. For example, feeling down or fed up, and this can be because people are less able to do the things they used to do. People also report feeling stressed or worried much of the time. This can be about how they manage their health condition and other problems, including medication usage, attending appointments, having fears about the future, feeling embarrassed when in public, finding it hard to keep active, and other problems that can lead to stress. People also report feeling concerned about their breathlessness, and this can lead people to feeling very panicky and stop people doing things that they enjoy or that they need to do. This in turn can make it really hard to self-manage the health condition and lead people to feeling worse about themselves. Here are two examples of how our physical health and emotional health may interact with each other. With panic, people can find that they feel breathless. If they're more breathless than usual, they may have thoughts of, well, I can't breathe. If they have thoughts of I can't breathe, they may really focus in on their breathing. As that's happening, they may notice that they feel even further breathless alongside other physical symptoms of their heart pounding and dizziness. With this, the feelings of panic can very much be there, and that can lead to thoughts of I need to call an ambulance, and that may well be what people do. This can be very frightening for both the person but also the family too. With low mood, people can find with their physical health that they feel very fatigued. With that fatigue, they may stop doing their usual activity. That may lead to thoughts that can be unhelpful of, well, I can't do anything and why bother? With those thoughts, the person may feel tense. With the tension, they may become snappy with family. With this, they may continue to feel low and worse about themselves. These two examples often get described as a vicious cycle. There are a number of things people can do to enhance their well-being and physical health. Whether you are newly diagnosed with COPD or whether you've lived with the condition for a long time, people often report not feeling completely clear about what it is. So learning more about your health condition and how to manage it can be helpful. This can be done through speaking to health professionals, attending pulmonary rehabilitation, through charities like the British Lung Foundation and other reading resources. It can also be helpful to make changes to lifestyle. This can be improving diet, stopping smoking and increasing physical activity or exercise, which is a key part of the pulmonary rehabilitation programme. It can also be helpful to plan and develop a routine that includes things that you enjoy and things that are important to you. That might be keeping in touch with the family. It might be doing things that need to get done, which may give you a sense of achievement. It can also be important to take regular breaks and find ways and times to relax. Improving our sleep can be helpful, and trying to write our worries down and trying to look at the ones that can be problem solved. It may then be about setting goals and breaking these goals down into manageable steps. So let's say you've used all your usual coping strategies and yet you're still feeling low and worried. What can you do? Well, the good news is it's been proven that talking helps. Low mood, stress, worry, panic, they are not just a normal part of ageing, whether you have a physical health condition or not. As I mentioned earlier, our physical health and emotional health, they impact on each other. So if you're having a bad day with your physical health, it makes sense that that would then affect how you feel that day. Equally, if you're having a low day, a stressful day, feeling worried or panicky, it's understandable if that then makes it harder to manage your physical health. So focusing on your emotional health can be just as important as focusing on your physical health. So how can the Staffordshire and Stoke-on-Trent Wellbeing Service help you? Well, we can help you to understand the link between your mood and breathlessness. We can then help you with ways to manage your breathlessness, and this might include breathing techniques. We can also help you to develop a routine that's both paced and rewarding. We can help you to look into unhelpful thoughts that are common when feeling low, stressed, worried or panicky. We can also give tips on better sleeping habits, tips on relaxation techniques, and we can help you stay connected to health professionals who are involved in your care. Here's a case study of someone who accessed a service. For them, the main problem was panic when feeling breathless. They found that they felt more breathless and panicky during activity, so they'd actually started to avoid quite a few activities for fear that they wouldn't be able to breathe or they could pass out. Here's a vicious cycle that we captured of when they would go up the stairs, which was a trigger for their panic. During going up the stairs, they'd feel more breathless than usual. That led to the feelings of panic and led to thoughts of, I'm not going to be able to breathe. So they started to use their inhaler more. With the breathlessness came other symptoms of feeling hot and trembly, and their breathlessness was worse. They felt panicky, and this was starting to lead them to think they were going to pass out. So they would stop on each step, go up the stairs really slowly, hold onto the banister. And ultimately, because this kept happening, they found that they were avoiding using the stairs at every opportunity. So what did treatment involve? Well, first of all, we started by learning about anxiety and the effects anxiety can have on the body. This helped the person to think differently about the physical symptoms they were getting. They were using breathing techniques, one in particular called diaphragmatic breathing. This is one they'd use when feeling panicky, but they were also using it in between activity too. We talked about helpful positions that can be really beneficial when someone's feeling breathless. We talked about pacing activity. This meant not doing too much or too little, but also finding time for relaxation. Here's another cycle. This time it's not a vicious cycle. This is how things changed by using the techniques. So when going up the stairs, they'd now use diaphragmatic breathing. They'd think to themselves, I'll be okay. This helped them to feel calm and led to the physical symptoms easing. The breathlessness calmed down. This meant they were more able to use the stairs and they were starting doing other activities too. Here's some feedback from people who have accessed the service. Some people found the telephone appointments to be convenient and the written materials useful. For other people, learning about breathlessness and ways to manage it meant they could stop panic attacks occurring. For other people, the breathing exercises really helped them to feel more calm and more relaxed. If you can relate to what I've been talking about today and you'd like to discuss your experience, then please get in touch for us to start the conversation. A referral can be made in many ways, through your GP, through the respiratory team. You can also refer yourself by phoning the telephone number on this slide or by using the website and doing an online referral. Once we're in touch with you, we'll offer you an initial appointment, and this initial appointment is an opportunity for us to learn about how your physical health and emotional health may be impacting on each other. Then we'll be able to tell you more about how we can help. We usually offer face-to-face and telephone appointments. However, due to COVID-19, like many other NHS services, we've had to make some changes. So we are still offering telephone appointments and we're also offering video appointments as well. The good news is it's been shown that no matter how the treatment is delivered, it can still be equally as effective. And for people who have used the video appointments, they found it to be convenient and they've enjoyed seeing the person they're talking to or that they're working with. So if you'd like to make a referral yourself, you can call the 0300 number. And if you have a Stoke-on-Trent GP, you would select option 1. If you have a North Staffordshire GP, you would select option 2. I'll just leave this slide up for a few moments in case you did want to jot anything down. But as I've said, you can speak to health professionals about making a referral too. Thank you for joining me for today's talk.